So this discussion is going to focus on pathophysiology. So what we're going to be looking at here is we're going to be examining cell structure. We're going to look at how the cell responds to even injury and trauma, look at how it responds and look how it responds to disease states. So that's going to be the big focus of this current discussion. So again, an overview, we're going to look at the cell, talk about homeostasis and what that means. We'll talk about the individual components of the cell and how it gets affected by disease and injury. And we're going to look at this from the standpoint of both systemic and structural effects. So, obviously, the main focus in this class isn't necessarily to look at, again, orthopedic structural injury. We're still going to talk about that, though, as far as how the body recovers from that in this chapter. So you have a good idea as to how the cells go through the process of healing. Some of that information is going to be a review of what we had talked about actually in therapeutic modalities. So a lot of that stuff should sound familiar outside of the fact we might get a little bit more in depth into the individual tissues and how they're affected, because obviously, all the different connective tissue in the body has, slightly different components and responsibilities, and it's important in the healing that kind of can change things a bit. So if we look at homeostasis and pathophysiology, so homeostasis is the process that regulates the kind of the biochemical equilibrium in the body. So basically your body wants to be at a, let's just say for the most part, a normal state. That's probably the easiest way to be at, okay? So in other words, like, we have an optimal range for our blood sugar to be at, okay? So if all of a sudden you ingest something that's very high in sugar, that sugar is going to get absorbed into your bloodstream. Well, your body detects that, and what does it do? Well, it releases insulin to take the excess sugar that's in the blood and to get it out of there and to store it in the different parts of the body where it gets stored. So that's just a real brief example of what we look at as far as regulating homeostasis, okay? And if that homeostasis gets thrown off, again, there's certain disease states, and diabetes would be one of them, where that equilibrium gets thrown off, and again, there's health consequences to that. So, and we're also going to be looking at pathophysiology, which is just the cellular mechanism of disease and how the cell responds to disease and some of the different parts of the cell. So here we're going to look at the actual cell. So the cell is the basic unit of all body tissues, and we're going to talk about both a little bit about the structures, and we're going to talk about what are the different types of adaptations of the cell. So if we look at the structures, table 2.1, again, this should be a review. We've all had, science, some sort of science class that has covered the cells and the parts of the cell. So if you look at that, it gives a pretty good rundown of the functions, so make sure that you are familiar with the individual functions of the different structures. And again, when cells are put under stress, they have one of two options. They either adapt or they die, and they adapt in several ways. In this picture that I have posted here, we're going to go through the different types of cell adaptation that we're going to be discussing in the chapter. So if we look up here, we have 4 cells. It doesn't matter what kind of cells they are, they're just cells, okay? And then here, we have 5 different types of adaptation. So starting over here, we notice that the cells have gotten smaller. That's what we refer to as atrophy. So for instance, as we get older, our muscle cells tend to atrophy, particularly if you are if you're sedentary. Now, if you're older and you continue to, say, strength train at an appropriate level, you'll maintain, if not even maybe put on a little bit more muscle mass. But the muscles will look to atrophy. So again, muscle is very metabolically active. So, as you get older and it's harder to maintain that, or just even if you look at situations where a body part is immobilized. So, if you have a if your arm is fractured and it's in a cast, you know, the body kind of sits there and says to itself, well, you know, we're not using this. We don't need the muscle here. Let's shrink it. So the cells atrophy. Okay. Over here, you notice we've gone from 4 to 6. Okay, that's what's called hyperplasia. So hyperplasia is when there's a change in the number of cells. Now, there's another kind of addition to that. So it's not just a change in the number of cells, but it's a change in the number of cells without changing the rate of cell division or cell function. Okay, so if you start to get a change in the rate of cell division and cell function, you got something different. You got some additional things going on. It's not just pure hyperplasia. So hyperplasia is just when there's a change in the number of cells without those two dynamics kind of occurring. And again, this is usually going to occur due to, you know, an increase in metabolic demands, different genetic abnormalities, hormone imbalances. You know, during a female's menstrual cycle, when they're going through menstruation, there's hyperplasia is one of the things that are taking place with the cells in that region. In the middle here, we notice the cells have gotten bigger. That's hypertrophy. So that's an increase in the size of the cell. So classically, that's, you know, the most basic, simple example of that is, you know, the response we get to resistance training. Okay. Some people will argue that they're, you know, depending upon the type of resistance training you're doing, you could also get some hyperplasia. I think there's some merit to that, but it depends on how you're doing the strength work. But most of it's going to come from hypertrophy. Over here, you notice the cells just kind of change their shape a little bit. Okay, we're going to call that metaplasia. So this is when you're replacing the cells of one type with the cells of another. So these are just different types of cells. Okay, that's why they're round instead of, I guess, more square shape that you'd be looking at there. Okay, this is usually going to be in response to some type of physical or kind of chemical irritant. So again, that's actually something that happens with menstruation. This, you know, which would be a normal process, but, you know, if we were to look at something, say, you know, abnormal or wouldn't be optimal for the body, is like when you have a smoker. Smokers many times will have metaplasia taking place in their lungs, where certain cells will start to take on different characteristics because of being exposed to the cigarette smoke. And then here, you see the cells are just kind of, I guess for lack of a better way of putting it, they're just sort of messed up, okay? And this is when you get what's called dysplasia. So this is when cells adapt by changing to an abnormal type of cell. They increase their rate of cell division and they increase their cell number. So, you know, here we're still showing 4 cells, but you could have an increase in number because your rate of division. So in other words, they'd be breaking up and dividing a lot faster. This is basically what happens in cancer, okay? So, you know, in cancer, you know, part of what goes on, there's a malfunction in the DNA replication with tumors, and that's what happens, and that's where you start to get your neoplasms. So that's what, again, we call dysplasia, okay? Now, again, if, you know, if cells can't adapt, they die. Now, sometimes not a big deal, sometimes it is. If you get a large number, for instance, of cell death in an organ, that could be a problem because the organ's going to be impaired. So cell death by itself is probably what's going to happen, particularly when you have like just physical injury to the body. But you got it just kind of the impact of it on the body is going to be based upon where it is and what's got affected. So cell damage. So again, cells have to either adapt or die. Okay, if they die, you know, we call that necrosis. Okay. So, you know, we talk about necrotic tissue. That's tissue that's dying, okay? When we look at damage to tissue, so again, here we're kind of going back more to the structural aspects of the body, so you could kind of get an understanding of this. And then a lot of this, again, should sound very familiar because we talked about this in class, in modalities class. You know, we have two mechanisms of healing where a tissue will either regenerate or be replaced with scar tissue. Structurally throughout the body, most of the time you're going to have tissue getting replaced with a collagen, with a thick collagen scar that will, you know, physically through rehabilitation we look to manipulate and work with. Okay. And within the healing process, we have the three phases. We have the inflammatory phase, the proliferative phase, and the remodeling phase. And we have the phases kind of broken down by tissue type. So you could kind of look at that table and sort of see the time frames for, you know, a ligament versus a tendon versus a muscle versus a bone, and kind of see some of the differences. And we're gonna talk about some of the, I guess, nuances of each one of those tissues. But, you know, look at the time frames, and most of them are similar. I mean, when you look at the inflammatory phase, the bulk of that for most tissues is going to be 48 to 72 hours. It could be a little bit longer, could be a little less, just depends on the extent of the damage, but that's mostly what you're going to be looking at. You know, a nerve is a different one where commonly it's going to be a little bit longer, even sometimes upwards to 7 days. But we're going to go through the process. And again, we always talk about the inflammatory phase is always the one that kind of has the most, again, for lack of a better way of putting it, it has the most stuff going on. There's a lot that goes on during the inflammatory phase, and the goal of the inflammatory phase is to kind of just contain the injury and to help remove debris from the area. So that's really, the inflammatory phase is very important, albeit there are some issues with the inflammatory phase that can cause problems for the patient. So if we look here, okay, so again, our push in this class is going to be more, you know, non-orthopedic related pathologies, but for the discussion purposes here, we're going to use an orthopedic pathology because obviously it's what we have to do to get this point across. But, you know, so we have this injury, and we can clearly see this is going to be a lateral ankle sprain. So the cardinal signs and symptoms of inflammation you're going to have that are going to occur. So one of them is going to be pain. Well, why do you have pain? Well, quite frankly, you have tissue damage, so that's going to cause pain. Tissues are going to get damaged. There's, you know, ligaments going to be damaged. There's going to be small nerve endings damaged. That's all going to cause pain. You also have these inflammatory chemicals that are going to get released that are all going to go out and irritate nerve endings. There's also going to be some ischemia that takes place. Okay, there's going to be some decreased blood flow to the area. You know, in a situation of an injury like this, it's not going to be large enough to cause extreme damage, and the body can eventually adapt to it, but it's still going to happen. Swelling, okay? There's going to be initially, at least anyway, early on, increased blood flow, which will gradually decrease as the swelling builds up and the pressure gradients don't allow as much blood flow to get to the area. But you're going to be getting more plasma fluid in the interstitial space because of the gapping that's going to be taking place within the circulation. Erythema, okay, so redness, that's going to be occurring as well. You're going to have heat, okay, and you're also going to have loss of function, okay. So they're all going to kind of tie in. So these are kind of your cardinal signs of inflammation. Now, again, the inflammatory process has to take place, okay? But the problem is we have to be able to control these aspects of it, obviously, because in order for the person to proceed and kind of optimize their healing. Because, yes, if this individual, say this individual didn't do a thing, he didn't do any rehabilitation, he didn't use any modalities, would he get better? Would the injury heal? The answer is yes, but it's not going to heal optimally, and it's certainly not going to heal very fast. We want to look to do things that'll both speed up his recovery, and in addition to having that area heal in an optimal manner. So we look at the inflammatory process. So if we're looking at this, so here we have our cell damage, so we have our injury, contents of the cell are going to spill out. So we're going to have inflammatory chemicals and everything kind of lingering out. There's going to be proteins that are out here, both from the damaged tissue and coming out of the cell, which is going to draw fluid out. If we look over here, okay, the blood vessels, remember, are going to dilate. Now, why do they dilate? It's because we want to get these white blood cells out into the area, because the white blood cells are going to go out and kind of clean things up, Okay, now the problem with that is that's where some of the swelling is going to come from, because you're going to start to get an increase in interstitial fluid because of the the plasma proteins that are out there, and some of what goes on with the action with the white blood cells kind of cleaning that out. So it's going to cause an increase in the interstitial tissue pressure relative to the capillaries. Okay, so this is our acute inflammatory process still here. So here we're looking at, again, more of that dynamic going on with the circulation. So if we're looking here, so here this is under normal conditions. So here we're kind of demonstrating, again, kind of that mechanism for that increase in swelling. Okay, so this is normally what happens. So here's your your artery would be coming into your arteriole. You have your capillary. The capillary is where a lot of that exchange of nutrients and everything is going to take place, and then it leaves at the venule. Okay. Now, under normal conditions, again, obviously we need nutrients to get out. We need oxygen and everything for the tissues. But with that, some free proteins get out. But again, if circulation's normal and everything, your lymphatics aren't getting blocked for any reason, the lymphatics will pick that up, and everything remains normal. Well, this is what happens with an injury. Okay. So you have much more gapping taking place because the white blood cells have to come out, and the free proteins, which are naturally going to leak out, plus the cellular debris. So there's cellular debris from the tissue damage, which will also create a gradient to kind of pull more fluid out. The lymphatic system gets kind of overwhelmed and can't control it anymore. So one of the things we do with reducing edema and swelling is to make sure that the person's moving, because that's how the lymphatic vessels will work. So in the case of an acute inflammatory response, you're going to get chemicals released. We briefly kind of mentioned that the chemicals released are going to cause some pain. So you're going to have histamine, bradykinin, prostaglandins. They're going to be regulating that process. And one thing that those chemicals are going to do is going to cause the capillaries to dilate, become more permeable, because we need that. But they're also going to cause an increase in pain, particularly bradykinin. Bradykinin actually has chemical properties very similar to snake venom. So that's going to cause an increase in pain. Eventually, what you're going to get is fibrin formation. So fibrin formation, remember, it's that clot that begins to form over the damaged area, and that's actually going to serve as the base kind of for your scar tissue for anything that was damaged in the area. So fibrin is going to start to form a little clot over the area, and then in the damaged tissue and then the smaller damaged circulatory structures, that's going to begin the process for scar tissue formation. Leukocytes are going to come out. So the chemicals released by the damaged tissues are also going to attract leukocytes. They're going to be the white blood cells that go out, help to remove debris from the area and kind of clear the area out so that the healing process can continue to take place. And then you have the circulation changes. Now, the issue that goes on with this and why we want to control this process, again, to say you want to eliminate inflammation is not what you want to do, because you need inflammation to take place. You want to limit kind of the side effects of inflammation so that you can heal in an optimal manner. So we want to, we know that, eventually a person's tissue would heal if you don't do anything, but it's not going to heal in a good way. And so, we want to make sure that we control swelling and everything so that we don't experience, for instance, as much tissue ischemia, which will cause more what we call secondary tissue death, if you remember that from modalities class, where other cells that weren't initially affected by the injury start to die because of the lack of blood flow and oxygen to the area. Okay, so again, think of those cardinal signs of inflammation. So again, think of where pain's coming from, where the swelling's coming from. The erythema, I think I kind of went through the erythema and the heat, but again, they're going to be caused by increased regional blood flow and plasma fluid in the interstitial space as well. So that's going to contribute to that. Obviously, the loss of function is going to be because of pain and swelling, so that they do kind of interact with each other. Now, when you talk about chronic inflammation, some slightly different things that are going to take place. And there's issues that come along with chronic inflammation that you need to be aware of. So you're going to get prolonged leukocyte action. There's a much greater activity of the larger macrophages during chronic inflammation. In the case of looking at the overall healing process, you're going to get increased fibrin and collagen formation, which is going to cause more scar tissue to form and take place. And then you look at the common signs and symptoms of chronic inflammation, you know, things like aching pain, pitting edema, mild to moderate muscle spasm, increased local tissue temperature. And basically, the chronic inflammatory process is going to take place until the cause of damage gets removed. So, you know, chronic inflammation is basically taking place because there's this persistent stress to the area that it's just not able to get through the healing process. And again, there's different things we obviously do in our treatments in order to help modify that. So if we move on to proliferation and remodeling, so the proliferation phase is when we actually start to get the formation of the scar tissue. So this is where the scar tissue starts to form. You know, usually within, 14 days, you usually have a pretty good scar starting to form there. And that's going to be because of fibroblast activity. Now, again, that activity does start fairly early in the process. Even a little bit, it might overlap. It's going to overlap with the inflammatory phase. The other thing that's going to happen here is the tissue is going to become highly vascularized because the scar as it's forming is going to need blood flow in order for that healing to kind of take place. So there's going to be a vascularization. There's going to be capillaries that form that will eventually go away over time, but they're going to form to kind of help that healing process take place. And then you have your remodeling phase, which is going to be both a breakdown and deposition of collagen. So collagen is going to change from what we call type 3 collagen in the proliferation phase to type 1 collagen during the remodeling phase. So type 3 collagen is very unorganized and weak. Type 1 collagen is organized, kind of based along the lines of tissue stress, and it's a lot stronger. But your body also wants to make sure you don't have too much of it. So it also kind of wants to regulate how much is there, which again, through activity and appropriate progression and rehabilitation, that'll also take place. The scar tissue will also need to realign during the remodeling phase. And the remodeling phase, in some cases can take up to a year to take place. So, if you get a grade 2 ankle sprain, it's not completely remodeled for months to a year till that scar tissue really realigns. Now, most people don't take a year off from an ankle sprain, but, you just have to understand that the rehabilitation process needs to continue to take place with that. So, we had mentioned a little bit about chronic inflammation, but we'll just kind of restate it as its own thing. Again, we had mentioned the long-standing or repetitive chemical irritation of mechanical stress. Again, prolonged biochemical leukocyte action, and that's going to be primarily by the larger macrophages. You're going to get more fibrin, collagen, so there's going to be more scar tissue taking place. And again, this kind of inhibits tissue healing. So you kind of get stuck in that chronic inflammatory phase, and what that does is it doesn't allow the tissue to fully heal and will cause some prolonged signs and symptoms. And, we had mentioned again, you get more of the aching pain. If they have edema, it's probably more of a pitting edema. So you can, you see this actually sometimes even in ankle sprains. It doesn't necessarily mean that, they're necessarily in a chronic inflammatory state. But, if they have swelling, and it's very common for swelling to have some edema to have some difficulty going away. Pitting edema is when you could kind of stick your thumb into it and you take your thumb away and your thumb imprint kind of remains there. That's when you know they have pitting edema. So it almost takes on like a kind of gelatinous type of texture as opposed to more liquid. Again, mild to moderate muscle spasms, increased local tissue temperature. will all be things kind of associated with the chronic inflammation. So then we have, when we look at infection, so infection is its own inflammatory process. However, it's a specialized inflammatory process. And when we get into the chapter on the immune system, we're going to look at how the immune system works and how, the body, when exposed to a virus, bacteria, how it actually takes place. That's an inflammatory response. It's a little different. There's some cell action. Obviously, for instance, the white blood cell action is much more involved in the inflammatory process. So it's a much more widespread reaction. You get some other systemic symptoms. For instance, you get a fever when this is going on. So the fever is going to increase your metabolic demands. It's going to cause an increase in your respiration rate. It's going to cause tachycardia. It's going to catabolize muscle. You also get other symptoms when you have this. So you could be diaphoretic. You could, you experience lethargy. If you think about when we talk about flu-like symptoms, okay, that's from the inflammatory response. That's your body trying to, if you will, fight whatever bacteria is impacting your body. As I said, we'll get into the immune system when we discuss that. So we'll get into more detail as far as the cells and everything involved in that process. So let's just kind of look at what goes on with bone and cartilage. Again, the table that I referenced earlier is very beneficial, and it kind of summarizes some things. And again, I want you to kind of know the time frame. Again, when we look at the functions of bone, bone does a lot of different things. It provides a framework for the body. It acts as a lever for the muscles. It provides protection. It also is an area where red blood cell production takes place. So that's what the bone does in the body. Some people tend to forget about the whole red blood cell thing, the framework and levers for muscles. They tend to remember. When we look at the cells, we have different types of cells. We have osteocytes, osteoblasts, osteoclasts are what we're going to be talking about. So osteocytes are your mature bone cells. Osteoblasts are the cells that build up bone. Osteoclasts are the cells that break down bone. So bone is constantly being remodeled. Bone is getting built up, bone is getting broken down, okay? Ideally, we want to optimize that process, okay, as we look at bone. So, for instance, a breakdown in that process occurs when you have a stress fracture, okay? With a stress fracture, because of, for instance, some abnormal stress, maybe even some issues with, nutrition and things like that, you actually start to develop a small fracture or crack in the bone, okay? And that's due to a disruption in that remodeling process. So if you look at the different structural components of the bone, and you kind of look at the picture here and see these. So you have the periosteum, which is the innervated vascular structure that provides nutrition to the cortical or the compact bone. The cancellous bone has its own blood supply and contains bone marrow. You have the yellow, which is the fatty bone marrow, and you have the red bone marrow, which produces red blood cells. If you look at the joint surfaces, they're covered with what's called articular cartilage. So an important point about articular cartilage is that there's no nerve supply, and there's no real blood supply to articular cartilage. It's avascular. So when it gets damaged, it doesn't really heal very well. And usually the pain from it, again, it's avascular, so it's not the damage, or it doesn't have a nerve supply, rather. It is avascular, but it's not having the nerve supply that creates a situation where it's not the direct trauma to the cartilage per se that's causing the pain. It's the subchondral bone that's exposed that's going to be what's actually causing pain. And when we look at bone, there's two basic types. I had mentioned the cortical bone. So you have the cortical bone, which is the compact bone, and then you have the spongy bone, okay? And again, that part of the responsibility of the spongy bone is, again, we don't just want these, if you think about just the stress that bones are under, they have to be able to kind of be able to take on some stress and strain without breaking. And that's why we have the spongy bone and all those channels within there, coupled with the fact that, again, some of those areas are also responsible for the remodeling of bone that takes place in the body. So here we look at we're going to look a little bit more at some of the issues with both the bone and the cartilage. So obviously osteoporosis is, a pathological process associated with bone where a person's going to have a decrease in bone mass. Many times that gets preceded by, a diagnosis of someone having osteopenia, which is an initial decrease in bone tissue. You have fractures, obviously, which, again, make note of the healing process with bone when you're looking at fractures. Osteomyelitis is an infection in the bone. So this requires a good deal of attention. This is something you want to try to avoid, particularly when you have compound. This is what makes compound fractures, such a significant issue, is that you want to avoid that osteomyelitis. So in the compound fracture, the person is going to be typically put on IV antibiotics to help prevent that. So with articular cartilage, you have a couple different things. You have the physical trauma, you have an osteochondritis dissecans, which you can see that in the picture above, where there's a little fleck of articular cartilage that kind of gets stuck inside the joint. You can get inflammation from osteoarthritis, so a breakdown in the articular cartilage, rheumatoid arthritis, which is an autoimmune disease, and you can get infection in the cartilage as well. Again, an important thing to note about cartilage, again, as we said, it's avascular, it doesn't have a blood supply, so the problem is that if cartilage gets damaged, it's going to get replaced, either going to get replaced with fibrocartilage, which is not the type of cartilage, it's a different type of cartilage, or it's not going to get replaced at all. Either way, you're going to have some type of issue with the joint that in all likelihood will have to be addressed. And there's no nerve supply. So if there's pain associated with it, it's not directly caused by the articular cartilage damage, but it's getting caused by the other, in most instances, the subchondral bone underneath that is now exposed. So, take a read through the whole response to disease or injury with this. It gets a little more in depth into what goes on as far as the procedures with the inflammatory response. Again, most of that stuff we talked about, it's just going to get into what it looks like as far as bone and cartilage. So read over that, just maybe make a couple notes to yourself, because I still want you to be responsible for how the process of disease is affected for the individual tissues we're discussing. So connective tissue, epithelium, and endothelium. Okay, so all our connective tissue in the body is going to be composed of collagen and elastin. So we have different types of connective tissue in the body. We have skeletal muscle, we have tendons, we have ligaments. So connective tissue is going to attach body structures, muscle to bone. It's going to attach organs to bone. The higher proportion of collagen, the stronger the tissue is going to be. If you have elastin, the whole purpose of elastin is elasticity. So collagen provides strength to tissue, elastin provides elasticity. And, the higher the strength needed in tissue, the higher proportion of collagen. So it's going to be a little different between the different types of tissue. Epithelium is a structure that lines the interior and exterior surfaces of the body. So this includes the skin, the GI tract, the pulmonary tract, and it just provides a barrier to the external environment. Okay, so for instance, the inside of your pulmonary tract is lined with cellular epithelium. Okay. And again, that's just to help provide a barrier. Your digestive tract has epithelium in it to help protect it. Endothelium lines the cardiovascular system. So endothelium is going to be responsible for helping regulate the exchange of substances between the blood and the other organs. So endothelium is particular to the cardiovascular system. So if we're just looking here, again, all these tissues are going to follow a typical inflammatory response. So whether it's connective tissue, epithelium, endothelium, pretty much a typical inflammatory response. Again, connective tissue heals with collagen only. So it's really important that that collagen can hopefully be remodeled in a very optimal fashion. And, you know, for instance, if we're looking at just the pictures that we're kind of examining here, in some instances, the original tissue may be regenerated. For instance, in muscle, very minimal trauma to a muscle, you could actually get muscle regenerated. So that's an example where that can take place. If a DNA gets affected, you could end up with a cancerous lesion. So epithelium and endothelium, this is more commonly seen in epithelium and endothelium because they're more prone to cancer because of exposure to the environment. You know, for instance, in the digestive tract, you're eating stuff, so you're taking things from outside of the body, putting it inside the body. So if for some reason the epithelium there would be damaged for whatever reason, it could predispose somebody to dysplasia and forming some type of cancer. You know, another thing to realize is that when there's damage to connective tissue involving organs, you know, for instance, collagen scars in the abdomen can cause constrictures around the intestinal passageways. So that can cause, you know, blockages and obstructions as well. So, you know, sometimes, you know, we don't think of scar tissue as being a big deal, but in those situations, there can be some more extensive issues involved. So looking at muscle and nerve, with muscles, we're going to talk about muscles a little different in a different context aside from tendons and ligaments, because we have different types of muscle. We have striated, cardiac, and smooth. So striated muscle is basically the muscle that we look at with, you know, our body structure, you know, our muscles throughout our body. The cardiac muscle is obviously in the heart. There's some different issues with, obviously, you know, trauma, pathology, if you will, to cardiac muscle. And smooth muscle is what's in our organs. With nerve cells, if we look at the nerve cell up there, we have different parts of the nerve cell. You have the dendrite, the cell body, and the axon. The dendrites bring information to the cell body. The axon takes information away, so we know nerves communicate with each other throughout the body for various functions. Again, damage to muscle cells, and I think I might have kind of thrown some muscle reference in when we were talking about connective tissue. Part of the reason is because it heals similar to connective tissue. Now, obviously, when you look at cardiac muscle and smooth muscle, there's going to be significant function getting impaired with that. So again, it's going to follow a similar healing process, but the ramifications of it is going to be much different. So if you strain your hamstring and, you know, have a, you know, maybe a slight tear in your hamstring, the tear in your hamstring as it heals, the impact on your body is going to be much different than if you, you know, have, you know, damage to, again, an internal organ made up of smooth muscle. There's different ramifications to that. Damage to nerves, it depends on where the damage takes place. So damage to the cell body of a nerve cell is permanent, and damage to any portion of a nerve cell in the CNS is permanent. However, in the peripheral nervous system, nerves can regenerate. Now, they regenerate very slowly. So if you have damage to nerve in the peripheral nervous system, you'll get about regeneration of about 1/4 of an inch a month. So it does take a really long time. Down here in this picture, I'm just showing you a brachial plexus injury. So if you have a severe brachial plexus injury where, you know, the actual structure of the nerve tissue in the brachial plexus is damaged, it can regenerate, but it's going to take a long time. So, you know, the deficits are going to be noticed for a pretty long period of time, particularly if you have, you know, a more severe grade of injury like a neurotmesis taking place with the brachial plexus. Now we have some special cells throughout the body. These kind of relate back to a little bit more involved within the organ systems throughout the body. So we have, for instance, we have mucosa cells, which are in the gastrointestinal tract. We have acinar cells in the exocrine pancreas. We have islet cells in the endocrine pancreas. We have hepatic cells in the liver, renal cells in the kidney, and endocrine cells, within the various endocrine glands in the body. So again, the cells of the various body systems, they can be affected by all of these different things that we talked about as well: physical trauma, disease, toxicity. Again, you could look at their specialized function based on location. So again, that table kind of breaks that down a little bit more for you. Hemorrhage and shock can occur because a lot of these organs are very highly vascularized. Obviously, any type of trauma to endocrine glands, which is rare, can cause issues as well. There could be issues with toxicity. Cancer can damage these regions. The issue here is we're going to talk about, again, they're going to go through the same inflammatory response, but the ramifications as far as function here now gets to be a bigger deal because of what all these different organs are going to do. So looking at the special cells here, so the specialized cells are going to look at various body systems, and again, we had talked about that, their individual responsibilities. So they're going to follow a typical inflammatory response. Now, the issue with that is, here you're going to have scar tissue forming in areas where now you're going to be impairing function. So these cells have very unique functions that if there's going to be replaced by scar tissue, so scar tissue, forming in a muscle or a ligament could essentially function, again, if it's remodeled appropriately, could essentially function the same way as the original tissue. Again, it'll never be quite as strong or as normal, it'll never be the normal tissue, but not going to impair the function as much. In the case of these special cells that I just went through, there's going to be significant functional impairments that will likely take place, particularly if there's a large amount of trauma. And just to note about blood cells in some of the processes, one major thing that can occur there is what's called septicemia, where you have a blood cell infection. There's other things that could happen with blood cells. There's metabolic changes and toxicity. And indirectly, they can be affected by trauma to other tissues as well due to the hemorrhage that takes place. So these are your learning outcomes and a kind of a breakdown of everything we discussed. So again, make sure, take some time in your reading to review tables. Again, one of the things, I don't remember if I mentioned this in the first lecture or not, but it might not be a bad idea because I do reference tables a lot. Your textbook has a lot of good tables that can help kind of delineate some of this information. You may even just want to pause the videos and go in, take notes, or just maybe jot some things down related to that as you're going through this.